This patient was referred to me for endodontic retreatment of tooth number 19. According to the patient, the root canal was done by an endodontist about 4 years ago. She received the crown first, and then tooth started to hurt. Her dentist referred her to an endodontist, and the endodontist went through her crown and did the root canal for her. Patient says for the past few weeks, tooth has been hurting. There is pain in her jaw, she described it, and also a few days prior, she noticed a bubble on her gum. She called it a bubble, and then when she pressed on it, she said pus came out. She went and saw her dentist, and her dentist referred her to us for examination and possible endodontic retreatment. So take a look here. The patient, by the way, is a heavy grinder, and she also admits that when she wakes up, some days her entire mouth, teeth, jaw, everything hurts. So take a look here. That's the crown build up, previous root canal, and you can see a periapical lucency here. So we discussed options with the patient. Patient wanted to try to save the tooth. This patient is young, and she wanted to try to save the tooth. Also, we always document everything. So take a look here. So that's the tooth here. As you can see, the endo access through the crown and was later restored by composite there. Look, this crown is cracked. About 1/3 of it is missing completely. And you can see the signs of her grinding. So today we went ahead and went through the previous endo access, removed the buildup, removed the gutta percha, and redid the root canal for her in one appointment. Everything went great. Take a look. Again, we document everything because we want to make sure that we don't get blamed. Oh, you broke my crown. All right, so take a look here. And this is one angulation. As you can see, everything went beautifully. 2 mesials, 2 distals. This was a radix entomolaris tooth. Look at this angulation here, and look at that beautiful lateral we picked up. That wasn't there when the other endodontist did the root canal originally, but we picked it up right here. And let me show you where this lateral leads to. Again, you can see the lateral right here. You can see the periapical lucency here. And look, there is a lesion here. You see that? There's a lesion there, and this lateral leads right into it. That means that we were able to clean 3-dimensionally this lateral canal here that harbored necrotic tissue and microorganisms, and we were able to obturate it 3-dimensionally right into that lesion there, as you can see. So everything went great. We temporized the tooth and referred the patient back to her dentist for the permanent restoration.